It seems like it never ends. Sometimes, like in the last few months, it seems like it's picking up steam. I'm talking about the psychotic pseudoscience involving blaming pain patients for opioid addiction. It's been fairly consistent in the literature as I've covered it. Pain patients who have never had a history of addiction before being prescribed opioids become addicted at a rate of about 0.6%. So why then do we see so many citations of larger numbers, including as much as 80% for opioid use disorder, OUD, also known as problematic pharmaceutical opioid use, or POU? A lot of it is, quite simply, how you define the terms. The U.S. government considers opioid abuse to be any use inconsistent with the label. So the label might say, take every 6 hours. As we've covered before, they don't actually last that long, so pain patients often take one after 3 or 4 hours. Even when it's done solely to relieve pain, it's considered abuse. Same with dependency or withdrawal. Different studies will tell you different things, but that's because they're using different definitions for the terms. So now we have a new meta-analysis from the University of Bristol. They looked at 148 studies involving 4.3 million patients in North America and the UK. That's 148 that they selected out of almost 5,300. Lead author Kyla Thomas, PhD, professor of public health medicine at the University of Bristol, said, quote, "Clinicians and policymakers need a more accurate estimate of the prevalence of problematic opioid use in pain patients so that they can gauge the true extent of the problem, change prescribing guidance if necessary, and develop and implement effective interventions to manage the problem. Knowing the size of the problem is a necessary step to managing it." Well, that last part is true anyway. The trouble is, the real problem is much smaller than what is generally accepted. They included studies that reported any sign of OUD, including abuse, tolerance, addiction, dependence, misuse, and aberrant behavior, whatever that is. It's Morton's fork again. If you take pills too often, you're abusing them. If you take too few, you're hoarding. In some studies, misuse even included patients who stopped taking painkillers completely because their pain went away. OUD was defined so broadly it could encompass anything. So they published their findings in the journal Addiction that 9.3% of pain patients have OUD. In addition, 29.6% have signs and symptoms of dependence, and 22% have aberrant behavior. By the way, some of these studies had sample sizes as low as 15. The university said in a press release, quote, "Companies like OxyContin manufacturer Purdue Pharma have claimed that fewer than 1% of opioid prescriptions result in problems for patients. This new review makes it clear that such claims greatly understate the risk of opioid misuse and addiction." Yeah, they're the ones with the problem, whereas you're so honest and lily white. They even titled their press release, "Prescription painkiller misuse and addiction are widespread in chronic pain patients." Yeah, after you ignore all the evidence that says it isn't. I mean, if you cherry pick that badly and define things that broadly, and you still can't manage to get OUD over 10%, how bad is the problem really? Stephen Nadeau, professor of neurology at the University of Florida College of Medicine, said, quote, "This is just one more paper, one of zillions, that seizes upon some outcome measures that have poor or no basis in science and that are not in any way indicative of addiction. As is so common, it favors the ridiculous notion that OUD is everywhere." He said the really big problem was one of pseudo-addiction, quote, "A patient in desperate pain asks for an increase in dosage. Instead of the request being interpreted at face value, the patient is branded with the diagnosis of OUD and booted from the clinic." And so this is going to be yet another trigger for additional restrictions, lawsuits, and oppression of pain patients, continuing the blatant misinformation that's being fed into medical schools. It's pretty clear that these people will not rest until all opioids are taken off the market and pain patients are all in misery or dead. Note that the very last sentence in the press release is the ever-popular, quote, "Due to the high heterogeneity of the studies, these findings should be interpreted with caution." Gee, you don't say.